Welcome to the Ailm Practice Education Series in partnership with Firm Media, delivering concise and impactful insights for aesthetic and specialty medical practices. Your host, Chris Solhonik.
Today we have a very special guest, Dr. Jonathan Kaplan, a board-certified plastic surgeon from San Francisco and the founder of DrWell by BuildMyHealth. Dr. Kaplan, I appreciate you being on the show. I've known you for a long time, but our listeners might not. So tell us a little bit about yourself and how you ended up, one, in San Francisco, and two, the founder of DrWell.
Thanks for having me. Excited to talk to your audience. Yes, I'm Jonathan Kaplan. I'm a board-certified plastic surgeon in San Francisco, but originally from Alexandria, Louisiana. And my wife and I moved here from Baton Rouge, Louisiana to San Francisco about 11 years ago. At that time, when I came over here, I was taking over a plastic surgery practice that had its own in-office operating room. And so I got all of that, including all the bills, once I got here. But like I said, that was 11 years ago. And before I moved out here, I'd actually started an app, and it was one of the, it was early on in the iPhone app industry called BuildMyBot, and that was allowing patients to check pricing before they came in for a cosmetic consultation. That way they would know a little bit better about the price, at least know the ballpark figure. And then we evolved into a price estimator on a doctor provider's website. So we went from price estimation to not only could the patient check pricing, then they could also purchase non-surgical services through the website once they found out the price. That evolved into subscriptions for Botox. And then that further evolved into subscriptions for medications from compounding pharmacies, including those for weight loss. And that's something we got into over the last couple of years. It's something that really started also in my practice. So we're wearing two hats here, but in my practice, we had patients coming in for tummy tucks and other body contouring procedures, but they weren't good candidates for surgery because their weight was too high. So rather than turning them away, our nurse and nurse practitioner suggested we start a weight management program. And so we got into that even before semaglutide, Trirzepatide, the active ingredients in Ozempic and Mounjaro were available. Started helping patients lose weight either through phentermine or coaching. And then those brand name drugs that everybody's heard about, Ozempic and Mounjaro, Zepbound, Wegovy, they went on an FDA shortage list, which legally allows compounding pharmacies to make a duplicate of these medications, even though they might be under patent protection. And so then we incorporated that into our practice. And then we incorporated that into the DrWell platform, because what we can help other providers do, not just in my own practice, but other providers, is we can help them automate those monthly subscriptions for the weight loss medications. And then once the patients are charged, that auto generates a prescription in the back end of our platform that the provider can go in and submit that prescription electronically to the compounding pharmacy. And we just help with automating that whole process of charging the patient. If their credit card fails, we automate the process of the dunning. So the patient will update their credit card if they want the medication. So a lot of that is taken off the hands of the front desk of the office staff. So all this together is, I'm a plastic surgeon. We now offer weight loss, just like a lot of other providers in America to start offering weight loss medications, because that's the underlying cause of what most doctors are treating these days, whether it's sleep apnea or erectile dysfunction or infertility. Obesity is the common thread. So a lot of providers are going to be starting off with this. And that's what the DrWell platform is doing, is not only helping me build my weight management program in my practice, but helping other providers do the same. And as I alluded to, it's not just weight loss, it's also hair loss or hair restoration. It can be for testosterone therapy, other hormone replacement therapies. And that's where we're wrapping it all up into the same platform that their EMR just cannot do. And
Sure.
We fill that void for them.
Sure. I really appreciate your entrepreneurial spirit. It sounds to me like you and I met right when you came about 11 years ago, right? We've done some...
After I moved to San Francisco, exactly right.
Yeah, I often tell people the only time I live in Los Angeles, and the only time I've ever been in the room with the Kardashians was with you in San Francisco. So,
yeah.
Interesting.
I'm about to say we met her, but we saw her at Kokari. We were out having dinner, and she walked in with the whole TV crew.
Yeah. The entire restaurant stopped eating for about an hour. So interesting enough. Anyways, we've exhibited together at trade shows. You're sort of just as much of an entrepreneur as I am, as a business owner. I know that you're super busy. So one, I want to thank you for taking the time to be on the show today. The essence of this show is for us, as I told you before we started, is to ask 3 questions. You already know the 3 questions. The reason for the 3 questions is for us to dig out the most useful information for our listeners. And what we really want to do is we want to create an environment for people to come listen to the Ailm Practice Education Series, spend 20 to 30 minutes listening to it, and then take home actionable information they can apply to their practice to make what they're doing either easier or better. Basically becoming a tool for being a trusted advisor for the practice. And so I'm going to jump into that. I'm going to ask you the first 3 questions. We're going to answer those, and then we're going to end the show with your Ailm Essential Insight, your key takeaway, and then we're going to be done. Cool?
All right. Sounds great.
All right, great. So the first question is, what is the big news about Trirzepatide being off the shortage list? What does it mean for patients, and can doctors still get it for those who need it?
All right. The short answer is absolutely. DrWell can still help all of our providers get access to Trirzepatide for their patients. No question about it. And so a little bit of background is that when these medications are on the shortage list, the compounding pharmacies I mentioned are able to make duplicates. Well, surprisingly, early in October, Trirzepatide, the active ingredient in Mounjaro and Zepbound, was taken off the FDA shortage list, which was a little bit strange because it happened without any previous discussion. And also the fact is that people still can't get access to the medication. There's still a shortage. Even though there might be a lot of it out there, it still cannot keep up with demand. So it was really strange that it went off the FDA shortage list. And when that happened, the 503A and 503B pharmacies, which are just the legal code from the FDA Food and Drug Cosmetic Act, those are just the legal codes for those 2 different types of pharmacies. 503A pharmacies can actually include the pharmacies like CVS and Rite Aid. But in this context, we're really talking about compounding pharmacies that can make medications that, if somebody needs a liquid version of a medication that's not, generally available, the compounding pharmacy can make that. If they need a dye removed from a commercially available drug, the compounding pharmacy can make that without a dye. And that's what 503A pharmacies do. 503A pharmacies also, just to make the distinctions clear, they are typically under the purview of the state board of pharmacy wherever they have a license in whichever state. 503B pharmacies are under the purview of the FDA. Regardless, all these compounding pharmacies are getting their medications from an FDA registered manufacturer. So the whole supply chain is really legit. It's not somebody out in the backyard, making these drugs like they're making moonshine in their still.
Sure.
So that's how we're getting. So because the medication are on the shortage list, 503A, 503B pharmacies are able to make it. Well, then all of a sudden, early in October, Trirzepatide, Mounjaro, Zepbound went off the FDA shortage list. So what does that mean? Well, according to the law, the 503B pharmacies only have 60 days to sell their remaining supply. So they can stockpile it, but then they have to get rid of it all within 60 days. So DrWell was still able to get all those medications for all of the Trirzepatide for our providers and patients during that 60-day period. 503A pharmacies, because of the legal gymnastics here, they don't have that 60-day wind down period, but what they do have is that they can continue making the medication indefinitely as long as they change the formula by about 10%. So either way, whether it was the 503B or the 503A pharmacy, we still had access to Trirzepatide. And when that happened, we were actually able to reroute all of the prescriptions that our providers were submitting through our platform, and we were able to reroute them to a different pharmacy that had it available. And so none of our providers missed a beat. They were still getting all of their, the subscriptions were still being charged for the patients each month. They were still able to submit prescriptions. And that is something why providers need a platform like us, so that we can do all the due diligence. We can have all these connections to all these pharmacies, and we can flip a switch and reroute all their prescriptions to another pharmacy. They would not be able to do that so quickly and seamlessly on their own.
Sure.
Now, the follow-up to that is that the Outpatient Facilities Association, which 503B pharmacies are considered outsourcing facilities, just another name for them, but the Outsourcing Facilities Association sued the FDA saying that you didn't give us any fair warning, in addition to the fact that the medications are still on shortage. Like, you might be able to say that each dosage is available, but there's still a shortage. For example, if you contact your distributor and say, you know what, I've got 100 patients on Mounjaro, I need 100 syringes of Mounjaro, they'll say, we can give you 2. Okay, so it's available, but obviously not in adequate quantities.
Sure.
So they sued the FDA, and within a week, the FDA said, okay, we're going to put a moratorium on our order that took it off the FDA shortage list. We're going to reevaluate this. And so for now, compounding pharmacies can continue making a duplicate of Tirzepatide, and we will not file any action against those compounding pharmacies. So it's not technically back on the shortage list while they discuss this with the Outsourcing Facilities Association, while they continue to work this out with them and discuss this with them, that all these compounding pharmacies can still make Tirzepatide. So the point is that this was sort of a dress rehearsal of what it would look like if they ever go off the shortage list.
Sure.
We now know that you got 60 days to get it from a 503B pharmacy. The 503A pharmacy is just going to adjust the dosage and be able to offer it indefinitely. Either way, DrWell performed with, beautifully in this circumstance where we're able to reroute all the prescriptions. So we know that we've been able to, through this dress rehearsal, we're able to prove to our providers that they can have uninterrupted service and access to Tirzepatide, even though it was sort of a false alarm.
Sure.
But eventually something like this will happen again. And also keep in mind that eventually Ozempic will go off the shortage list, but it'll be a revolving door. There'll be a new medication that comes on, because I think people think that Big Pharma is just they're gonna make Ozempic and Mounjaro and call it a day. Like we've had success, we're helping people lose weight, but there's so many new medications in the pipeline that when those get released, those will quickly go on the FDA shortage list, and the compounding pharmacies already have formulas for those and they'll start producing those. So a revolving door of GLP-1 medications, which is this whole class of drugs that have been around for over 20 years. And so that is the story of Tirzepatide. It was off the shortage list, still sort of off the shortage list, but you still can get it. And the main thing that I want to convey is that, yes, you might be able to find a pharmacy that will ship it to you, but the critical thing is that if there is an interruption, you want to have access to a platform like ours that will provide you uninterrupted service. Because if you're bringing in $50,000 a month with these weight loss medications as a subscription program in your own practice, overnight losing $50,000 in monthly recurring revenue is gonna sting. So we keep that from happening.
Of course. So, I think you and I lost touch a little bit over the last 5 years. You were aggressively working on Build My Bod when we were sort of speaking and presenting together or exhibiting together. And then Firm Media has kind of gone in a different direction. And you were obviously building DrWell, which is something that I didn't know about until some of our clients at Firm Media started having conversations with me about sort of working with you or talking to you about working on projects. And some of these people that I work with are some of the smartest clients that we have. So as soon as a few of them got on board, I reached out to you instantly and thought, well, if these people have already vetted this, then this is a really great thing. I immediately started telling some of our other clients about it who have signed up. So I want to ask you some questions about that as well, because I think I do agree with you. You know, my job as a marketer is to figure out what the top line revenue drivers are for specialty and aesthetic medical practices are. Really invest in trying to tie myself to their revenue goals and make that happen. And if 300 patients on GLP-1s equals 100 grand, and I think I'm doing the math somewhat correctly, but if 300 patients on GLP-1s equals an extra 100 grand a month in reoccurring revenue, and it also moves some of those patients towards their weight loss goals to be able to have the plastic surgery that they want, then I think your program is a really great thing. Like I said, it's been vetted by some people that I think are very smart. So I'm excited to ask you some more questions about that. So question number 2, how has incorporating a weight loss program like DrWell impacted your practice and some of the other practices that you work with?
Well, certainly there's the revenue generation, that monthly recurring revenue, because the patients are on these subscription and medications. And I think some providers think, oh, they'll be on it for a few months. That's great. And then they'll get off of it. I think that's kind of short-sighted, and not just from the revenue perspective. I think the patients are going to be on these for a very long time, not just for the weight loss, but these medications are also being proven to reduce heart disease. They're showing there's data out there that's eventually going to get FDA indications for improving fatty liver, improving chronic kidney disease, helping with alcohol use disorder, maybe curbing appetites for smoking. And then also it's been shown that there's maybe it's slowing the progression of reducing the risk of progressing to Alzheimer's disease. So there's a lot of seemingly disconnected benefits of these medications, but there's also people talk about how it reduces inflammation in the sense that patients are having less back pain and joint pain even before they lose the weight. So it might be easy to say, oh, well, you lost 100 pounds. Of course, that's going to improve your joint pain.
Sure.
But even before people lost the weight, they were having improvements in their aches and pains in their bodies. So there's this other aspect where it reduces inflammation that's sort of a nebulous thing to say, but it's, there's a lot of patients out there that says it's helping with their inflammation. So I think a lot of patients are going to continue on these medications for the rest of their life. Maybe they don't necessarily need to take one shot a week 4 times a month. Maybe they can get away with some maintenance dosages like 1, 2, or 3 shots a month. So these medications can be long-term monthly recurring revenue, but it is such instant gratification for me as a healthcare provider or as a surgeon. There's always so many operations I can do, but when people wake up from their surgery, if they have perkier breast, a flatter tummy, they're back to their pre-pregnancy state, they're thrilled, they're happy. That's very satisfying for me, but there's only so many of those mommy makeovers I can do in a month. Whereas with these weight loss patients, there's hundreds of them, maybe thousands of them in your program. So that's a lot of instant gratification that these patients have. And so in a weird way, some of the weight loss patients are maybe even happier than the mommy makeover patients, not because I didn't do a good job on the mommy makeover patient, but it's just the amount of time that they were unhappy. So like the mommy makeover patient, maybe they had their kids starting 10 years ago, so they've been unhappy with their body for 10 years. You improve that, they're really happy. But with weight loss patients, it's more than 10 years. Maybe they've been overweight their whole life. And so you finally are helping them for 30, 40, 50 years, and they're so grateful. So it's a great thing. But the other thing about it from a business perspective, aside from the emotional perspective, from the business perspective, it's been really great because it's not a loss leader. It's not like you have to buy this $200,000 laser and then you end up having to reduce your price to compete with everybody else that's got a laser. And it's a loss leader just because you're hoping you're going to get them in for other bigger ticket items. These medications by themselves can help take care of all of your operating expenses. And so that if somebody in my case signs up for surgery, well, that's just surplus funds that I actually put into my rainy day account. I don't even use that as my operating expenses account anymore. So from a business perspective, it's really a great medication, a great service to include. But with the DrWell platform, and I always try to convey this in different ways to help people understand why this is different. It's instead of it being direct to consumer, it's provider to consumer. So with direct to consumer DTC, it's like a website that is providing these tools to make it easy for patients to sign up for medications. Well, we're taking those tools, and instead of just the doctors being independent contractors with the DTC platform, we're a provider to consumer PTC platform where we're offering all of these automated tools to help make a provider easier to provide all these services.
Sure.
The big difference for the patient is with the DTC website, you have got nobody to follow up with if you're having side effects, which these medications can have side effects, even though they're typically mild, treatable, and time limited. Whereas with the provider to consumer PTC platform, we are helping the patients connect with healthcare providers who stay their doctor. They're not just some independent contractor they'll never see again. We're actually connecting with a real provider, with a real practice who can help them with whatever it is, hair loss, erectile dysfunction, hormone replacement therapy, weight loss medications, but then they still have follow-up with that provider if they're having any issues. And so that's really what makes us different as a PTC platform versus DTC. And also the other big difference for the healthcare provider, instead of just paying you a pittance to be the independent contractor for each consult you do, you're getting a majority of the revenue in the process.
Well, this is the big difference between, say, like a Roe
or a Hims.
Henry Meds or something like that, right? Where you're not even really seeing a doctor most of the time. Especially, what I think is really interesting on the GLP-1 side of things is if you're seeing a plastic surgeon and the end goal is maybe that surgery that you wanted, then there's a game plan in mind and you're being nurtured and along in the process, which I think is fundamentally different than a physician's assistant through Roe or Henry Meds, right?
Well, and the other thing is that, if it's, let's talk about more than just plastic surgery, because we have providers on our platform that are OBGYNs, dermatologists, cardiologists, and you might be thinking like, okay, I can understand why a cardiologist would be involved in weight management, but why a dermatologist? Because go back to what I said earlier, almost everything that healthcare providers are treating nowadays, the underlying cause is associated with obesity. So one of the most common causes of acne is obesity. So instead of treating the acne only, the dermatologist can treat the underlying cause, the obesity. OBGYNs, infertility, helping with the obesity, treats the infertility. And that's why this is what's so nice about this is instead of you having to seek out a different healthcare provider or go to an independent contractor, go to a website and have an independent contractor who you see once or talk to once. This way, patients are actually probably being able to get connected with their existing provider. Like you're already seeing this OBGYN, now you can get their weight loss medications from them. You already trust them, or your orthopedic surgeon. I mean, we have from every type of provider we have on our platform because it just shows you how whatever they're treating is associated with obesity, like ear, nose, and throat doctors that we are using our platform. They are not only treating the sleep apnea now, they're treating the underlying obesity that's leading to the sleep apnea. So it basically kind of is returning that doctor-patient relationship to what it used to be with a PTC model, a provider-to-consumer model, that you're just getting connected with your provider, the same provider, your existing provider, somebody you know, but just making it so much more consumer-centric or customer-friendly with the online booking and the automated charges, and you don't have to necessarily go in to get your medication. It can get shipped to you. And it's just, and also we're building out like an internal messaging system so the provider and the consumer can connect easier with with each other. It's just taking all those DTC benefits and putting it back in the PTC world where you actually have follow-up now and that continuity of care.
So talk to me a little bit about this. You're in California. There's a set of rules and guidelines for prescribing medications in California and shipping that stuff to California. And then we have all of the different rules and guidelines across the United States. But you have a network that you've built. I don't know exactly how it works, and I'm very curious to sort of hear how you meet the needs of, say, someone in Texas or someone in New York as well.
Yeah, all the more reason why you need to have access to a platform like this, because it's just hard for a provider to handle. They don't have the bandwidth to do this all on their own, to keep up with all the legal aspects. We've got a general counsel that we've had webinars with. And so we're kind of doing all that vetting and research and legal work for you so you don't have to. And so we have access to the pharmacies, especially in California, where it's hard to find a compounding pharmacy. So we've done all that research, like 5,200 compounding pharmacies across the country that we have all the contact information of, and we know what medications they offer. We know what states they ship medication to. So just to walk you through it, the healthcare provider gets a lead either through our platform or on their own. They do a virtual or in-person consultation with the patient, and the patient wants to sign up for their subscription. The provider goes into the back end of our platform, clicks a button to send a link to the patient either via email or text. The patient clicks on that link. It brings them to a white labeled page where they enroll into that subscription. They're charged. We handle all the merchant processing. And then that auto generates a prescription. And then the healthcare provider reviews that auto-generated prescription that we've created in the back end of our platform. They review it. They decide whether they want the med shipped to the patient or to the clinic. They click submit. And then our system, through what we call AIE Prescribe, we automatically figure out where that prescription needs to go, because maybe the provider is in California, but the patient is in Texas, and because the provider has a license in Texas. Our system will look to see if the pharmacy that that provider usually uses, can they ship to Texas? Oh, let's say that compounding pharmacy can ship to Texas. No problem. They send it to Texas. But let's say that compounding pharmacy can't ship to Texas. Then our system will automatically find the next compounding pharmacy on the priority list, see that does in fact go able to ship to Texas. And then our system will route the prescription automatically to that pharmacy, who will then ship it to Texas. And because we know what the cost of goods are for that particular dose, and because we know if there's any shipping cost included, we withhold that money from let's say the $500 monthly subscription payment the patient already was charged. From that $500, we withhold the cost of goods, we withhold the cost of shipping that pharmacy may charge. And then what we do is we just send the net revenue to the provider, so they just get the fee for their service. And then we send those cost of goods and everything, the fee that we withheld for the cost of goods, we send that directly to the pharmacy. So we're clearly separating those two things, which is actually a benefit from a legal perspective, because then there's no evidence that the provider was upcharging the meds.
Sure.
But since we're paying all of the cost of goods to those pharmacies, we're then purchasing a lot of medications on behalf of these providers. And that's legal, that you can the provider has to write the prescription, but it doesn't matter who's paying for it. But because we're paying for all these cost of goods from one entity, from DrWell, we then get these bulk discounts, which we then are able to pass along those credits, those discounts onto the provider. So even if they were able to find the pharmacy, they're never going to get the discounts that we're able to get for them.
Sure. It's very smart. Very smart. So
Thanks.
my third question, I think we've already answered, but I want to ask it just in case there's anything to add to it. Why is DrWell such an effective solution for providers in your network?
Well, I think that before early October, when Trirzepatide went off the shortage list, I would have told you that we automate the process. You're not having to keep credit cards on file in your practice. You're not having to manually charge them each month. The bigger nuisance is, that credit card eventually is going to fail and your office staff isn't having to act like a bounty hunter and try and track down the patient. We automate all that. The other thing with these medications is that each month they go up in a higher dose. That's just the way the name brand drug regimen works. If you're not using our platform, then you're going to have a spreadsheet of every patient of like, okay, they're on this dose and now next month they go to this dose. Got to keep track of which dose they're on. We automate that process where the dose goes up automatically each month unless you lock it in. And then if you aren't using our platform, then you're going to have to find out the different compounding pharmacies. You're going to have to learn that portal and, do the double data entry of putting in, already put the data into your EMR. Now you're going to have to put the data into the compounding pharmacy for that patient. We do all that. The patient enrolls on their own through our platform. So when we auto-generate that prescription, we pull in all that patient data so you don't have to do that data entry. All those benefits of the automation and the reduced cost from the cost of goods, from the bulk purchasing, that's what I would have said is the main benefit of our platform before the meds went off the FDA shortage list. And after they went off the FDA shortage list, again, we had this great dress rehearsal where we were able to see how we were able to perform. And we passed with flying colors where we were able to reroute everybody's prescriptions overnight to the right pharmacy that could still get them their meds. And nobody missed a beat. Everybody still had their monthly recurring revenue come in. So it's a no-brainer. And people will say, oh, well, I can do those things with my EMR. And let me just tell you, you can't. Your EMR may have automated billing, but it won't do the automated billing on the same every 28-day cycle, which is very important. It might do it on the same day, which means the patient's ultimately going to get their meds late. So there's different things that people might think their EMR could do, but they just don't do it exactly right for your needs for your patients. Because if your patients get their meds late, there is nothing unhappier than a patient getting their weight loss meds late in the mail and missing their dose. So that's kind of, so before and after the Trirzepatide shortage, a shortage list fiasco, that's where we come in to help.
Talk to me a little bit. You said something about receiving their medications late. This is a medication that traditionally has to be refrigerated. How is it?
It is. And so that's one of the things we help our providers with. If they, there's benefits to shipping it directly to the patient from the pharmacy. There's benefits to have it shipped to your office. The main benefit of having it shipped to your office and then you distribute it to the patient is that you have control of your supplies. You have control of the tracking information when you send it out to the patient. But again, that's up to the provider to decide how they want to do it. But yes, when they're shipped out, they do need to be on ice during the summer months. The compounding pharmacies actually require overnight shipping because it gets really, really hot, specifically in California and Nevada. So we have to adjust for that pricing change. But we actually are really going to an overnight shipping for all of our patients or all of our providers, because that's just what's convenient. And the patient really kind of expects it now. The playing field has changed a little bit. So we provide that overnight shipping, but yes, it has to be kept on ice when it's shipped out, even though it's been tested and shown that it probably can survive for 75 hours up to 220 degrees. We're not taking that chance, but when they get it, they put it in their fridge. So whether the compounding pharmacy is shipping it on ice or if it's getting to my office and then we ship it to the patient on ice, it's really, those are best practices. And we help our providers figure out all the logistics of that. As far as if they want to ship it from their office, we tell them what size styrofoam box to get. We tell them how many ice packs to get or where to order those supplies from. So it's all things that we kind of, rather than we don't want them to reinvent the wheel on anything. We've done all the work for it. And so that's why we're able to help them scale so quickly if they're starting out their program. Or if they already have an existing program, then they're going to benefit from joining with us because they're going to all of a sudden get reduced cost of goods, and overnight their net revenue is going to go up.
Cleaner, easier, more organized. Yeah,
no question about it.
I get it. All right, so that's the end of our show. This is the part of the show where I ask you for your Ailm Essential Insight. One key takeaway that our listeners can take and apply directly to their practice because of the GLP-1 topic. One key takeaway about GLP-1s and maybe adding it to their practice.
So first thing is you're not going to be able to do this effectively on your own, as effectively on your own. You're not going to be able to compete with the direct-to-consumer websites. You need a provider-to-consumer platform or model to help you compete. And the other thing is that if you think that, oh, everybody's already doing GLP-1s, it's too late to get into the game. Nobody says that about Botox. Everybody around you is doing Botox or offering Botox. You didn't stop to say, oh, well, they've already got Botox, I'm not going to do it. Oh, they've already got a website, I'm not going to build out a website. So you need to do GLP-1s, incorporate GLP-1s into your practice, even with this whole Trirzepatide thing, that, again, it's a revolving door of meds that are going to go on and off the shortage list. This is going to be so critical. This is the biggest thing since penicillin, and you'll be remiss if you don't incorporate this into your practice, because it's going to make your patients happier. It's going to create more loyal patients, and you'll be able to lead them to other services that they already want. The whole thing is, it's not about cosmetic surgery. It's not about plastic surgery. It's about lifestyle and wellness now. Those are the buzzwords, but it's such an all-encompassing offering that you can provide to patients. And GLP-1s is just the first step.
Sure. I really appreciate you being on the show. I've learned a lot. There's a couple things I want to talk to you almost right after the show, because I think there's some things we'll be able to add to the marketing aspect of things. So I really appreciate you being on the show. Thank you. And I can't wait for this episode to come out.
No, looking forward to it as well. Thanks so much for having me.
All right. Thanks.